Kate Shenny, 85, had terminal cancer. She informed her doctor she wanted assisted suicide. However, her doctor was concerned that Kate did not meet the required criteria for mental competence because of her dementia and determined that she did not have the very high capacity required to weigh options about assisted suicide. So the physician declined to authorize the lethal prescription. Mrs. S had been struggling with malignant lymphoma for 3 years. It had spread from her lymph nodes to her bones, brain, and spinal cord. She had chemo and radiation therapy, but still suffered from considerable pain and was kept under advocate control with medication. Her primary physician had offered her an extra large amount of pain medication for her. However, Mrs. S declined the offer and kept stating, "This doctor wants me to kill myself." After the law was passed down that PAS was legal, Helen had requested for one. She had a history of breast cancer and was enrolled in hospice. She had been using a wheelchair for 2 weeks and had some shortness of breath for which she used oxygen for. She had no pain, so her physician declined her request. She went to another physician and he as well declined her request because he believed that she was just depressed. So, what do all these three scenarios have in common? Yes, that's correct. PAS, also known as physician-assisted suicide. After many years of debate, the legalization of physician-assisted suicide has not stopped the conversation regarding this controversial healthcare issue. Physician-assisted suicide is a choice that every person suffering from an incurable disease who wishes to end their life should be given the right to make, just like how abortion is a choice. Now, according to the Nursing Standards of Practice on Ethics outlined by the College of Nurses of Ontario, in 2009, nurses must follow the 7 ethical values listed, and one of them is respecting client choice. Despite the ongoing political debates, the specific requirements of the medical assistance in dying law, or the ethical issues that come with such a controversial topic, nurses are the stakeholders that patients turn to when they want to discuss end-of-life care. Nurses are trusted and known to respect and advocate for patient values and wishes. The Supreme Court of Canada's decision to legalize PAS on February 15, 2016 has not stopped the political debates surrounding this topic. Brown and Russell explained that Section 14 of the Criminal Code of Canada states that no person is entitled to consent to have death inflicted on them, and everyone who aids or a person in committing suicide commits an indictable offense, respectively. However, this government ruling has not stopped the debates between Canadian citizens. Although it was found that large majority of Canadians actually do support PAS, there's still that controversy with religious individuals and also healthcare providers, especially nurses. Edwards does explain that the Canadian Nurses Association allows nurses to request to not be assigned a patient requesting PAS if it does conflict with the nurse's moral beliefs. However, at the end of the day, nurses must keep with professional practices and provide safe, compassionate, competent, and ethical care until alternative arrangements are in place. Quebec was the first Canadian province to legalize PAS, which occurred in 2014. Restrictions include individuals who are mentally incompetent and unable to give consent. The Canadian Medical Association, Royal College, Canadian Nurses Association, and the College of Family Physicians of Canada help prepare healthcare professionals by providing them resources to discuss PAS with clients and family members. Ontario's approach to PAS is one that balances the rights of the client and the healthcare provider by respecting current laws and policies. In Ontario, there have been 87 medically assisted deaths and the average age was 71. In Alberta, there have been 29 cases with a high demand of 2 to 4 requests a week with an average age of 67. The new medical assistance in dying law has finally made it possible for Canadians to choose to end their life and to be active leaders in their plan of care. Nurses can become involved in PAS by respecting and supporting their patients' wishes and teaching and providing support for families. It is now possible for nurses to advocate for PAS if that is what their patient requests. As this ethical, political, and human rights issue has been legalized, healthcare professionals are one step closer to allowing Canadians the right to leadership and participation in their plan of care.